Hi, I'm Congresswoman Jan Schakowsky.
And I'm Congresswoman Doris Matsui. We're the co-chairs of the Congressional Task Force on Seniors.
As we approach the 2-year anniversary of the Affordable Care Act on March 23rd, we just wanted to take a moment to celebrate this historic legislation and highlight some of the benefits the law is already providing to our nation's seniors.
The Affordable Care Act is a huge step forward in consumer protection and makes important improvements for all Americans. We want to ensure that you know about the law's benefits so that you are able to take full advantage of them. One of the most important things for you to know is that the health care law provides Medicare recipients with free preventive services.
That's right. Some of the services you can now get for free are cardiovascular disease screenings, diabetes screening tests, mammograms, flu and pneumonia shots, and a free physical exam when you join Medicare. That's not even the full list. The Affordable Care Act also provides an annual checkup, cost-free, so that you can work with your doctor to create a wellness program designed to meet your personal needs.
We're happy to report that 32.5 million seniors have already received at least one of these free preventive services. We've actually heard from some seniors who, because they could actually afford these services, were able to catch health problems that might otherwise have gone undetected. We hope that now that you are aware of these free benefits, you will use them too.
There's more good news. The law is also helping to lower Medicare prescription drug costs. If you have a Medicare prescription drug plan, Part D, you may be one of the 4 million people who each year falls into the coverage gap known as the donut hole. This year, the gap starts after your drug costs hit $2,930. Before the Affordable Care Act, you would have been responsible for paying the next $3,600 out of your own pocket, with no help from the drug plan. However, the Affordable Care Act has started to close the donut hole.
To help reduce drug cost payments, the Affordable Care Act provided Medicare Part D enrollees with a 50% discount on brand-name drugs in 2011. Enrollees also received a 7% discount on generic drugs. As a result, 5.1 million seniors and people with disabilities have saved $3.2 billion on their Medicare prescription drug costs, saving an average $635 each. In the first 2 months of 2012 alone, those in the donut hole have saved $93 million. And Medicare drug discounts will continue to grow each year until 2020, when the health care law will phase out the coverage gap entirely.
Medicare Advantage premiums are also lower, thanks to the Affordable Care Act. Since the law was enacted, Advantage premiums have dropped by 16%. In 2012, premiums are on average 7% lower than in 2011. And more people are gaining coverage through Medicare, with enrollment up 17% since the law took effect. The Department of Health and Human Services recently estimated that the average person on Medicare will save nearly $4,200 by 2021, and people with high prescription drug costs could save nearly $16,000 in that time.
Plus, the law is improving the quality of care seniors receive under Medicare. Doctors are being rewarded not just based on the amount of care they provide, but on the quality of the care they provide. If you're enrolled in a private Medicare Advantage plan, the law makes sure that more of your health care dollar goes directly to your health care, instead of to administrative costs or insurance company bonuses. The health care law is also working to improve long-term care, so you and your families have more high-quality options and greater peace of mind.
Additionally, the health care law puts new tools in place to help crack down on scams that target seniors and prevent fraud. Last year, those efforts saved $4.1 billion. These are just some of the ways that Medicare has been strengthened and improved by the new law.
The Affordable Care Act was a major step forward to providing affordable quality care to all and has so many great benefits for seniors. We hope that you've begun to see some of these benefits take effect in your everyday lives, and that the information we have provided will help you learn more about the Affordable Care Act can and will do for you.
We also hope that this will help dispel some of the myths surrounding the healthcare law. As you can see, the healthcare law doesn't take away any of your guaranteed benefits. It only adds to them.
Please know that we will continue fighting to make sure that you have the health care you need and deserve. For more information, please visit our website. And happy birthday to the Affordable Care Act.